Dr. House from the University of Michigan will talk to us about the Zoom interview and the virtual interview.
Yeah, so I'm the clerkship director at University of Michigan, and I've sat through a couple of the talks today, and so this will be like a repeat of some of the stuff I was talking about earlier. Dr. Price, the board that they had before that, talking about that. So we'll talk a little bit about the interview, and I know students, when I met with them, as far as I know, there has not been any decisions about if it's going to be virtual, if it's going to be in person, if it's going to be your choice between doing in person and virtual, or it's going to be virtual with second looks. I don't think any of that's been decided at this point, and it seems like, from what I've heard, it'll be decided on a specialty basis. So you may have friends that are going in person and some that are doing it virtually. But again, we'll kind of talk about some of the stuff regarding the virtual interview. And again, now that Zoom is so common for so many meetings, I mean, pretty much for the last 2 years, all of my advising meetings with students have really been virtually. That, some of this, again, is not going to be necessarily new news. They have no conflict of interest. So the other thing is again, people have brought up EMRA and other resources. So I actually took a lot of this from EMRA. So they have on their list of 5 steps for success for the virtual interview. So it's under the advising resources. And when I've met with my MSA students, even when I was talking in that group, again, look at EMRA, look at RAMS. There's a lot of resources you guys have online that's available. So take advantage of those. So they talk about, like I said, the 5 tips for success. And again, it was brought up earlier, I think, by Dr. Price, about like kind of creating your set, creating, where is your space going to be, and kind of looking at the camera angle, the lighting angle, and it's going to be a little bit of practice and playing around with it and what looks good, what doesn't look good, and with social media and everything else, there's actually a lot of tips that have nothing to do with medicine whatsoever, but it talks about again, like, what's your best camera angle. And actually, I'm reading through it, they actually go through a list of certain individuals who I actually don't know who they are because I'm not into a lot of that. But how, like, when you look at this person, they're always facing to the left, and here's why. And so again, there's lots of tips with, like I said, with lighting and angling that I think is a little bit beyond kind of this thing. But so again, take a look at your resources. Because what you don't, I mean, we've all kind of seen the forehead. We've all kind of seen the chin up, again, that angle, like 6 chins or whatever it is. Are you kind of too close to it? Are you too far away from it? So again, you just say, kind of practice in that location you're going to be at. Put the camera on, move it around. Again, so again, other resources. This is actually in regards to the business, because again, they've gone to a lot of virtual interviews or virtual meetings. So again, how to look good on Zoom, tips for video conferencing like a pro. So again, lots of resources on there. Make sure you fill the frame. Kind of have the camera at eye level or slightly above eye level, because again, so you don't get some of those kind of views of the chins and things like that. And then try and get some front lighting. I mean, you can go to Best Buy, Amazon, and there's lots of different lighting things that you can do. Now, one thing I've noticed with some of the lighting, especially if you're wearing glasses, again, you want to see what it looks like. So sometimes you've seen that reflection, or it's like that double eye kind of thing where they've got the reflection of the light off the glasses back at the camera, which can kind of sometimes be distracting a little bit. Know your background. You want to make sure and look what's behind you, because I've even done some mock interviews with students, and there was just like something hanging on the wall behind them. So every time they kind of moved their head, there was something there, and I found myself like, what is that back there? and not paying much attention to what they were actually saying. It was like command hook or something stupid like that. But it was it's kind of like, what is that? And again, I tell our students, and a lot of us in EM have a little bit of, or a lot of ADHD. So we see that squirrel. Oh, what is that back there? So again, take a look at it. And that's the other thing that you've seen. Again, especially when we started going to Zoom, some of those kind of quote-unquote famous videos of people who have had bras hanging in the background or whatever else in the background. So again, set that spot of where you're going to do it at, and kind of just look around. Record yourself on video. And I actually have this a little bit later, but record yourself on video. Okay, what does it actually look like? Virtual backgrounds. Again, we all need to know our biases. I don't like them, because I think I've definitely seen the ones where person shifts just slightly to the right and half their head disappears. So I've done the oral board exams for the last since we went virtually, and they have a background that you have to use. And I definitely have noticed when I'm sitting there, Sometimes my head disappears, sometimes my shoulder disappears, and I'm a floating head. Again, all those things can potentially be distracting. And again, it's kind of like, well, again, for most of us, this isn't one of those areas where you get an ABEM, I have to do a virtual background. For most of these, you don't have to. So, what's back there, kind of the, what are you hiding sort of thing. So again, nice professional background. I definitely have known plenty of students who, either use, like, get a bookshelf, put it back there. Again, making sure you know what's on there, because it can be good and bad. I mean, there may be, I think it was brought up earlier, if you've got art in your background, something that can be a conversation piece, perfectly fine. Like I said, just a blank, white wall, again, perfectly fine to have. Things is just like not going to be distracting, not going to be, unprofessional. And then, again, there are some of the virtual, kind of more professional backgrounds if you want to kind of frame yourself in that way. So the other thing is, again, Dr. Price talked to us about this, and she gave us a nice example about the young woman who got out to show their painting and then had like biker shorts on or something like that. So again, remember, this is a formal professional interview. Dress for success. Whatever you would, if this, I would say, imagine this was an in-person interview, and that's what you want to wear. One of our attendings talked about how, she was giving one of the interviews last year, and like her kid came and opened the door, so she got up and left, and she was like, oh my, about halfway there, she was like, do I have pants on? She had like sweatpants on. So again, it was fine, but it was like a nice top with, sweatpants on. The other thing to think about, again, depending on your setup, if the camera falls, what are you going to see? What are you going to look for? So you make it take a look at it. And the other thing is I kind of talked about it with recording things, is practice. This is probably too old for a lot of you guys now. But yes, so practice. And along with that, I usually say, practice when, practice where. I'm not going to play it, but the little screen thing I have is, I've actually had people who in the background, every minute or so, there's a siren that goes by because they live close to the hospital because it's easy getting back and forth. So again, practice at that time frame. They're doing construction next door. They can hear a jackhammer, every hour during the entire interview. So kind of practice the when, practice the where. Again, record yourself. Take a look at yourself, see what it looks like. Have someone else who's going to be honest look at it. I mean, having your mom is great, but may not be the best person to give you constructive criticism about how you, again, all these other sort of things. So, your mentor, like they talked about earlier, or an advisor, or again, your best friend, have them just take a look at that video. And even for in-person stuff, so I had a student a couple years ago who was just a very anxious student, and he knew that. So he actually videoed himself, and he realized some of like the tics and things like that he was doing that were going to be distracting. So he actually did a couple times practicing not doing those sort of things. So again, this isn't even for if you're in person, this can be something you use. And again, he just kind of put his phone up on his desk and just recorded himself and watched himself do it. So again, like I said, and then along with that videoing, it's kind of like the test and retest. Move your camera around a little bit. Move yourself around. Is it one of those things where, like I said, you have that virtual background and you shift your head and half your head's going to disappear? Or again, if you just change this way, does the lighting change? That all of a sudden you kind of get these shadows on your face. Because that's the one thing that's missing from the virtual interview is you miss a lot of the facial interactions. So again, if half your face is shadowed, you're going to miss that on the virtual interview as well. That body language. So again, if you're just the chin up, you're going to miss some of that as well. So again, even the background, like I said, especially if you use a virtual background, changing position, lighting again, moving your lighting around to see again, like I said, if you're wearing glasses, is there an angle that's better than the other so you don't get that reflection back, that kind of halo around the eye. Another thing is especially if you know ahead of time what program people are going to use, practice. So download the program. What you don't want to be is find out in the day that you are doing your interview that you forgot to click on this one setting, so your camera's not picking up, or your camera's not, your microphone or whatever else. So again, if you can, practice it. So there's a lot of them you can actually just go on there and like practice a call. So even like Skype, if people are still using Skype, you can go on there and just kind of do, like I said, a practice call or a fake call, just so you can kind of, is the camera working? Is the microphone working? Can you hear me? You maybe need to wear a headset, to help. Now, but again, even with that headset, remember that microphone for the most part is hanging out here, so you may not hear things around you because you've got your ears covered up with the headset. but the camera may still pick stuff up. Again, I was talking about, I did the ABEM board, and the way they do it is you do some of the interviews, and you usually have someone sit in, kind of for standard setting, and he sat in and he kind of chuckles like, well, how many dogs do you have? I'm like, dogs, what are you talking about? Again, I couldn't hear them because it had the noise canceling headphones, but they could hear it through the microphone. So again, like I said, practice with the microphone, practice with the different settings. And this goes along with the practice when you're going to potentially be interviewing. If you live with a bunch of friends who you're all going to be on the internet at the same time, so it's going to slow down that bandwidth or just completely lose connection. So again, try during that time. Is it where you see, does your library have a room that you can reserve for the day? Even the public library is an option. Is it where you can go to the med school and borrow a faculty's office, or do they have study rooms and then that you can check out and borrow? So that's one thing to say. So it's practice in those locations, practice at that time. And the other thing would be just willing to roll with it. So I have one attending who basically says technology, it's always a technology conspiracy. Our very first virtual interview last year, the entire campus lost internet. The entire medical campus, main campus of the University of Michigan lost internet. So they had to quickly change everything over to phone calls, to either people actually did some of it on video with the phones, and some people it was just a phone call. So that's what I was talking about earlier with Dr. Price. Having your phone charged, knowing where it's at, make sure it's not an area where it's sitting on the desk, so every time you get a text message or a phone, even if it's on silent, it's going to vibrate, which is going to make your camera vibrate, which is going to make you, all those sort of things. And again, you can actually get bonus points. If you show that you can adapt, your internet went down, or again, the entire campus internet went down, willing to roll with it, being able to still perform well. We actually did a quick study about kind of rating with our own individuals and kind of, okay, who had electronic issues, who didn't. And when we actually looked at the scoring, there was really no difference for those that had issues during it, loss of signal. I remember interviewing someone, looking at a black screen because for some reason their camera wasn't working. Their microphone was working, but their camera wasn't. So, again, being able to roll with it, being able to not let it really kind of throw you for a loop. So again, we've always had those Mondays. Again, just kind of trying to roll with it. So again, this kind of brings it back to the MRA, to the 5 steps. So they talk about creating a set, testing your tech, dressing for success, and then prepare and practice with it. Their number 5 is actually MRA can help. So again, taking a look at those resources and seeing what's available. So again, here's some of the resources. Again, ALIM has a podcast for students on virtual interviewing that's available. AAMC has some academic emergency medicine, MRA. So again, there's lots of resources you guys can take a look at. And again, like I said, it's practicing. Any questions at all?
I'll just throw out one thing that we didn't talk a lot about, but our lunch table talked a little bit about, is the idea of dressing for success. So Ryan had mentioned when he had an interview somewhere, he got an email that said, suits are discouraged or something. And he had told us that he showed up in a t-shirt, shorts, and flip-flops, and no one else got the message. And so he was really kind of out on an island, and we chatted a little bit about that. I would say I know we've gotten a lot less formal. I think I have. This is the first time I've had a tie on in 6 months, I feel like. But I would still plan on viewing this as a job interview, even if they say informal dress or informal attire. Just know that what you're wearing is a reflection of yourself. So in that situation, I probably would have gone no tie, but maybe a collared shirt, just in case, and not gone the full extreme of short sleeve shirt and shorts and flip-flops. But there are certainly places where that's the culture. It's just, if you're not sure, err on the side of maybe a little bit more professional dress, I would say. Do you agree?
Oh yeah, I agree completely. Yeah, I think at the kind of the bare minimum, we just said professional dress. That's fine. Go no tie, but maybe have it available. So if you realize when you do that orientation that, oh, I'm the only person not wearing it, that if you have a quick break or something like that. But yeah, I think you said I think probably the least I would go would be a no tie sort of thing.
Great. Thank you.
that's the session, team. Hopefully it was informative. Thank you all for being here. We would love feedback. Again, this is just so we can do this better next year. So tell us what went well. Tell us what we could have improved upon. There are a couple questions about demographics. It just helps us better frame and understand our audience, which is unfortunately data that we've not had to date. But none of it, it's all obviously all anonymous. Nick, anything else to add?
No, I'll just emphasize that I know we had some conversations in the hallway about, you know, the different types of matches, and we want to be able to serve all the medical students that come. The problem is, like, if we have just one session on, you know, international medical grads or the military match, then it doesn't necessarily resonate with the other folks. So we're still kind of trying to figure out the best way to do that, frankly. We did invite some people that are at places where they work a lot more with different types of populations of students, so hopefully you guys got to talk to them. We're available for a list of names, so in, I guess, conjuncture with the mentorship talk, if somebody really resonated with you today, shoot one of us an email, or you can reach out to us through the app. I think all the speakers, the agenda for the session in the app was not up to date, frankly, and it actually, the one that's up to date on my computer is actually different now after today. But we'll be able to put you in contact with that person. So it may not be one of us, but, you know, if somebody gave a talk and you thought that was a really great thing, I really want to kind of connect with that person. I think it's good.
If we want to access these PowerPoints and recordings later on, how do we do that?
Yeah, so that's a great question. And I don't know if in the back, you know, I think he's going to send the files to SAEM. So previously they had a Vimeo page that they were putting things on. There's been discussion about YouTube. I mean, I think these talks would be great for some type of platform like that. So what I'll commit to is to try to figure out where it's going to be and then to advertise that through SAEM. We don't ever really get a roster of the people that come, but they may have that where we could reach back out to you guys.
Yeah, presumably they collected an email when you all registered, and so we can try to gather that and maybe disseminate all the slides to everyone if we can get a hold of you. Otherwise, yeah, look for something on social media. We'll kind of tag the Medical Student Symposium and SAEM and stuff if SAEM, once we know where SAEM is going to do with these videos. But typically you maintain your access to them given your registration to this session.
So we're happy to take questions. I think we had 10 minutes built in at the end for you guys to get to the residency fair. I think most of you are probably going there. I know the CDEM Academy meeting is also at 3, so some of us are going to head that way, and you're probably going to the residency fair? Or?
I have a talk at 3.
Yeah. What's up?
Oh,
cool.
More time in this room, Nick. Just
Oh.
what you were looking for.
Gosh. I love it. Awesome.
Anyway, thank you all. And thank
Are
you for
they
your
bringing
engagement.
us dinner too?